welcome everyone here this morning to this kickoff on our center-wide functional programming. I can tell you we've awaited this day for not weeks, not months, but years, and you'll see evidence of that in just a few minutes. So it's very, very exciting to have reached this next milestone in our planning for campus development. For any of you who don't know me, I'm Anne-Marie Mellick, and I'm the President and CEO of the Center. And I have had the privilege of seeing this planning activity through from the beginning to where we are now. And it has been a very exciting process to date, but it's only the beginning. We have lots more excitement ahead of us. So just by way of background, let me say that what's significant about reaching this stage in our planning is that while it has taken us about 8 years of what has truly been an evolutionary process in planning for our new hospital, we're now in the final sprint. And we have only about 24 months before construction begins on our new hospital. So imagine that. We have an enormous amount of work to do that is going to involve and require input from across the organization in order to help us create, conceptualize, design, and then build what is going to be an amazing new rehabilitative center, one that models the way of the future. And we're very excited about this opportunity. To help us along with this next stage of planning, we've engaged what is called a PDC team, or Planning, Design, and Compliance team. And we're absolutely thrilled to have engaged HOK, Ben and his team, to assist us with this next very important stage of planning. And so I'd like to introduce you to Ben Enbier, who is the lead from HOK on our project, Debbie McDonald from Agnew Peckham, who has worked with us in the past, so some of you might remember her if you've been around long enough, and of course Gloria Kane, who's our VP Planning and Development, who will give you a very short synopsis of what's ahead.
Hi everybody. My name is Ben Enbier. I'm with the Planning and Design and Compliance team. So basically, you're about to embark on a very important part of this process, and we're here to help you through that. So a big part of what we do is we are design advocates. You're about to enter into a process where we're going to be engaging you through a series of different types of user group forums to try and really get from you some of the wants and needs that you're going to have for the new facility. And we're going to be working with you to document that and really capture it into a document that will be issued out to developer teams who will inevitably bid for and then construct the facility. So in that user engagement process, we're going to be setting up a series of workshops, visioning sessions, lean workshops, a whole series of different types of engagements. We're going to be looking to engage you and really draw from you information, anything from room requirements, whole facility requirements, how flow happens through your facility, really what some of the important priorities are for you. So this is a bit of a cross-section of our team. So HOK is a global architecture and design firm, and what we're going to be doing is bringing forward a subject matter expertise in a whole wide range of disciplines. So we're going to have functional programming, planning experts, architecture, mechanical, electrical, accessibility. So the idea is that we're about to enter into a conversation with you, and we're not expecting that all of you be experts, but we're really looking to bring some expertise to the table and have those discussions to really draw from you what's important to you. And our team is made up here of 5 groups or 5 teams, each led by a certain individual, including Debbie McDonald, who will be leading our functional programming, Patricia Canito, who will be leading our planning, Arnold Ortiz, who will take us through the municipal planning process, Mary Bella, who will take us through the output specification development, and myself, who will carry out really through construction. So the basic idea is we'll be working with you to develop the wants and needs of the hospital, and once those are documented, we're also going to continue to be by your side to evaluate compliance to those, both through the inevitable design of your facility and then through construction as well. So we're here for the long haul. What's important to recognize is that although we bring a host of subject matter experts, we are not the designers and architects and engineers of records. We're here really playing what is tantamount to an advocacy role, where we're here to help define your wants and needs, but ultimately there will be a whole team of that will include a development team that will include architects, engineers, and their own subject matter experts who will design the ultimate facility. So just be careful not to confuse us with the actual architects and designers of record. The process, so we're approaching stage 2 of the Ministry of Health process, which really focuses on the development of the functional program. So looking at some of the important clinical adjacencies, the room areas, the room requirements, really trying to articulate those and document those. That'll be a 7-month process approximately, and that'll continue through to stage 3, which will then having us develop a set of schematic drawings that will be illustrative of the functional program that we've developed. Accompanying that will also be a very comprehensive document that we'll develop in association with you that will represent the wants and needs of the hospital as it's going to be issued to builders to construct. And then stage 4 then has that document being issued to the market, and 3 development teams will go through a 6-month process to design to a fairly advanced level of resolution your hospital. And out of that you'll get a full design, including plans, sections, elevations, details, all of the technical information associated with the facility, the cost of the facility. You'll get a pretty good picture of what that facility could be. And then you'll have 3 schemes to be able to evaluate and choose from. And once the stage 4 process is complete, including the full evaluations and the finalization of the contract, stage 5 begins, and that essentially sets off the construction process. So from now through to the beginning of stage 5, that's approximately 24 months. Do you want to explain this?
Poor Ben.
I know the gist of it, but you explained it so well.
Okay. So really everything that Ben has talked about so far is going to make far more sense to you as we go through the process. And I'll be able to talk to you a little bit about it in my planning stages over in the corner when you can do your walk around. I do notice that David Garland has chocolate in his station, so he's luring you. Agnew Peckham has golf balls, so they're luring you. No one sent me the memo, so I tap dance. If you want to learn how to do a time step, I can teach you that over there. So that will be how I lure you. So you'll be able to go around and ask specific questions, and I have to say I've already had a couple of minutes, and you're asking really, really great questions. I've been asked about office locations. You know, is my office going to be centralized in one part and the patients that I deal with are in another part? Those are exactly what we're going to be talking about. You can talk to Debbie about that because she'll talk about those adjacencies, the flow, what's the best use of your time and your skill. So those are all things that we're going to get to go through over the next few months. And that's really what Ben is describing when he's getting up to that point of talking about output specifications. So are we going to meow or bark? So the reason that's come up is because at the last session we were talking about output specifications, and it's really hard to get your head wrapped around what that means. So I talk about, has anybody ever played that game where you put the card on your head, or the Ellen game where it's the name of the, and then you've got to sort of describe it and get to the point where the person knows what you're talking about. That's kind of the output specification process. And so, you know, you could say to potentially to a bidding team that you want a domestic animal, and it's fuzzy, and it's cute, and you can take it for a walk, and you can describe a whole bunch of things. It has 4 legs, and you could think that you've put terrific description into it, but you failed to tell them whether it meows or barks. So technically you could get a cat when you wanted a dog, or you could get a dog when you wanted a cat. So really, you are the people who are going to tell us whether it meows or barks. You are the experts of knowing exactly what it is that we need. And so we'll put the broad brush strokes on it and make sure that we've got, you know, those 6,000 pages documented, but you are so essential to this process to make sure that we get the cat we wanted or we get the dog we wanted, and I won't get into a debate of whether cats and dogs are better. I have my personal opinion. So I think that's really what this is intended to say, is that as much as this sounds overwhelming, it's kind of like the kids' game, and you are the experts. It's in your heads, you know how to lead us forward, and we're going to ask you the right questions to make sure that we get the best outcome. So you'll see in the background, Ben will be standing with a really interesting board that talks about the patient room of the future. HOK has been written up in the New York Times. Couldn't get better than that. So, you know, really talking about where we're going in the future. Debbie has a tremendous amount of experience in terms of functional programming and how to get us through. We have a fantastic team, and so it'll be great for you to mill around, ask your questions, and put your vision of the future on that little board over on the side.
And I'll ask Debbie to come up, and Debbie's our functional program lead, and she'll speak a little bit to the functional programming process.
Thanks, Debbie. So first of all, it's thrilling to be back here. We did the work with West Park back in 2006, and which did lead to this work, so it's really wonderful for our firm to be back working with some of you. I do see some familiar faces, many new faces, so we're very excited to begin this process. A functional program is technically the second stage of the Ministry's capital planning process. Essentially what it is it's a technical document that describes all of those balls in the funnel, what you do, how you do it, what your projected workload is likely to be, how we incorporate evidence-based design, patient-centered care. We take all those inputs and we then create space requirements. The functional program is the document that's precursor to the architectural plans. So in words, the functional program describes what you do, how you're going to provide patient care, how you're going to provide all of your support services, and what you require from your facilities in order to do that. So it really is the document that will describe how you want your programs and departments organized, what spaces need to be together versus apart, how do you interrelate with the various programs and departments, do you want certain departments planned together, far apart. So it's the words that will describe how the architectural design will actually evolve. For the functional program, we'll be meeting with a series of departmental or program-based user groups. But in addition to getting that input, the functional program will actually consider a variety of other specific segments of work that will feed into the work that we do with you. So lean process studies, we're about to engage on those. That will look at how you improve patient flow, patient-centered care, your information and communication strategy, how will that improve or inform the way you provide patient care, the way you communicate among each other, your support service systems, patient and family input, integrated design briefs, mock-up, all of that information will influence what we describe in the functional program, which will ultimately influence your architectural design. Mock-ups, just to give you an idea, that's actually where you take your thinking about individual rooms or the organization of rooms, and you actually mock them up. You actually set up a system so you can actually go through and feel what that room might look like, what it might feel like. So it's not you actually build the room, but you use tape or a variety of tools to actually let you get a sense of what that space might feel like before you actually go ahead and do the constructing. What you're probably wondering is, with all of these various stages, user groups, the various processes that will go across the functional programming process right through to the development of the project-specific output specifications, is how you're going to be involved, or how you and your colleagues are going to have your input. You work here day to day. I'm sure every day you think of, if only we could do this, or if only this space was over here, or if it could do these other things, the way we provide patient care would be so much more improved. Now is the time to think about those things and to work with us to get them into the planning. So there will be a huge number of user groups or ways of engagement for people to be involved. The functional program will actually be developed through a series of department or program-based user groups. There will be visioning workshops to actually provide some planning direction. The lean process study groups, again looking at specific operational flows and how they'll affect the programming. Patient and family focus groups. The departmental and super user groups are the program groups that will inform. And then town hall meetings, which is really getting input from people that might not be working here or that are working here and have some input. But we want to make sure that as we go through each stage of the planning process, we've considered input from a variety of perspectives. I'll now turn it back to Ben. And before I leave, I'd like to encourage you to come over and talk to Maui and myself from Magnapecum, and we'd be pleased to answer any of the questions you might have about this exciting process. Thank you.
So now is the time and the opportunity to engage in creating the future of West Park. We've talked about this for some 7 or 8 years. Now is our opportunity to actually put all of these great ideas and the core knowledge and understanding of the rehabilitative process, the importance of the clinical environment and practice setting, all into the development of our functional program and various design features. So we really strongly encourage you to take the opportunity to participate. In fact, we're counting on it. And we hope that today's kickoff session will give you an initial opportunity to ask any questions you might have. Please do visit each of the booths. Don't forget to get your raffle ticket. Good luck with the prizes, and do enjoy some snacks mid-morning. So thank you for coming. We appreciate your time.
Feet, right, currently.
Well, you say 92,000 square meters now, right?
But I think that's...
No, the budget is RG generated, so it's a guideline.
That's all being looked at. So it was actually really great.
Yeah.
That's not on the hospital property though, is it?
$3 million. And then once...
That's kind of